And the nation has been telling us, some of the leaders, not all of them, but certain leaders under control of certain government leaders have told us that children have a low incidence. They're not being affected by this virus. When that was put out there, people took that in as gospel. That children aren't affected, right? I mean, that's what you feel. For everybody listening to this, do you feel as though you believe from the information that you've heard that children aren't likely to be affected by this? Because that laid the groundwork for saying now it's okay to come back. But let me give you the real story. Because guess what? We can learn from the states that rebuked the system and decided to open up. All right, watch this. May 21, Texas reported 67 coronavirus cases in daycare centers. This is for daycare centers. On June the 3rd, the governor of that state announced that they had completely opened to the third phase. June the 15th, 210 reported cases in 177 facilities. That included 141 staff members and 69 children. Watch this, Dr. Thomas. That was June 15th. July 9th, Texas has reported 1,799 reported positive cases in children and staff that are at daycare centers. 1,207 staff members have reported. 592 children have reported as COVID positive. That's a 759% increase since June 15th.
Wow.
They told you your children would not get this virus. Dr. Thomas, do I need to go back through that again? Did that case study, did that hit home?
Yeah, this is serious. Now let me ask you this. So in March, did we just not have enough cases or information regarding pediatrics, children, adolescents, and so we were just going with that, the most vulnerable population, 60 and over, or what do you think about that?
Yeah, so it was novel. We actually had closed schools by then.
Sure.
So we had protected those kids. And so of course the incidence would be low because kids in schools had closed, kids had gone home, kids were being kept in the crucible of their home and protected. And so yes, the incidence was low. But when they opened up the daycare centers, so these are kids 1 through 6, 1 through 5, ages 1 through 5, the virus was able to really infect them, and we got enough data to show that they showed a 759% increase in 1 month.
Yeah, that's huge. Yeah, that's huge.
That's Texas.
Yeah, Texas alone. Yeah, amazing.
Now, Dr. Fauci, Dr. Fauci told us something this week that actually was last part of last week, and I can send you the clipping. He was talking to the Journal of the American Medical Association, to JAMA. He said, and this is different from his opinion. This isn't his opinion. He said, we have identified a novel coronavirus that's different than the one that infected us, that's even more infectious and has learned how to infect young people.
All right. So this is so we've got now 30 new mutations.
That's it. That was reported in China. And
yeah.
and look, and Dr. Thomas, I think I was the first one to tell about that. I think I was the first one to bring that forward. That China reported 30 new mutations. But now Dr. Fauci said not only do they know that we had 2 different types of this virus come. One came through Washington, and that one came directly from China, and one came from Europe, and that came to New York. But they have identified another virus mutant that is even more infectious, and it has learned how to infect young people.
Yeah, yeah. That's what I was going to say.
Now we're talking. What's the topic that you asked about? COVID-19 and school openings. Now we're laying all this down on this platform of school openings, and now this information that I'm giving you will help you make a decision.
Yeah, yeah. And this is huge because this comes mid-July. Your conversation you're sharing with us comes mid-July. People have got to make decisions one way or the other. Certainly there are state schools that are having to respond one way or the other to what the state is saying. There are private schools who are going to respond whatever way they want based on their religious freedoms or whatever have you. But the knowledge, I think, is empowering and is critical in this situation. So I'm so happy.